Good afternoon. We'd like to welcome you to the July meeting of the Alexander County Board of Social Services. I'm Cindy Holman. I'm the Director at Social Services, and I have the distinct pleasure today of beginning the meeting, facilitating until we are able to elect new officers. But let's get started with our invocation, and I believe Carolyn Gilreath is willing to do that for us.
Our Father, thank you for the opportunity to meet together and work with such caring people. Help us to make good decisions for the benefit of those we help in Alexander County. Help us to be grateful for all the blessings that we have. Be with those who are facing hard times or troubles in their lives and all that need our prayers. Go with us in a little while as we leave this place to go to our homes. Give us a safe trip. In thy name I pray. Amen.
Amen.
Thank you. And we will begin our meeting today with the swearing in or the re-swearing in of two of our board members, Miss Barbara Mays and Dr. Carson Mosley. So I think we have Danny Dyson, our clerk, with us today. Yes.
How y'all doing? Good. Hey, doing good. Hey, how you doing? And we'll, I think we're going to do both at the same time. Is that correct? So if I get one of you to hold that in your left hand and the other one put their left hand on there, and then both of you raise your right hands. There you go. Great. You got it. All right. There we go. And I'm going to read your oath to you, and when I acknowledge, will you state your name? And then I'll read the whole oath, and you can next acknowledge at the end, if that's okay. All right. Do you
Carson Mosley
solemnly swear that you will support and maintain the Constitution and the laws of the United States of America and the laws of North Carolina not inconsistent therewith, that you will faithfully discharge the duties of your office as a board member of the Alexander County Department of Social Services? Will you do that?
Yes.
All right. Thank you. Congratulations. I need y'all to sign here. You know we got to have a signature. Here we go, Barbara. There's yours. You gonna make copies or? All right. I should let you come over here. You have to write at an angle. You want them for now?
Yeah, and then I'll bring copies by to y'all.
All right. There you go.
Thank you, sir.
We thank you so much for coming today.
Thank y'all. Have a good meeting.
Thank you.
Okay. And our next matter of business would be to elect a board chair and a vice chair today. And so I will, at this time, open for nominations for the board chair position.
I nominate Barbara Mays.
Do I have a second?
I'll second.
All in favor, if you'd please raise your hand. And is there any opposition? Barbara, are you willing to accept that? Might ought to ask you that first before we vote. Okay, congratulations. And I will let you take over with the nominations for vice chair.
Do I get a nomination for vice chair?
I nominate Carolyn Gilreath.
Do I get a
Second.
It's been moved in second that we, Sister Carolyn be our vice chair. All in favor, say aye.
Aye.
Are there any objection? Carolyn?
I guess not.
It's moved in second that Carolyn will be our new
Train
vice
just pulled
chair.
out.
Okay. At, go on. Yes, okay. Next, do I get a move to accept the agenda for the day?
Make a motion.
Do I get a second?
Second.
It's been moved in second that we accept the, go by the agenda for today. Do I get a move to accept the minutes for June 18th, which you have in front of you? All in favor of accepting the minutes for June 18th as shown, say aye.
Aye.
Are there any opposers? Okay. At this time, we will have introduction of new staff by supervisors.
Thinking to Neil Herman, but
I don't believe we have any new, we don't have any new staff with us here at the meeting.
Okay. At this time, we will have the financial report with Sherry Deal.
Good afternoon.
Good afternoon, Sherry.
If you'll look in your packet, you have the June financials. And first off, I want to mention that these are not final. We're in the process of closing out fiscal year 2012-13. So there, I believe it is next week will be the last week that invoices will be paid that can be charged back to that year. Right now, if you'll take a look on the right-hand column of the expenditure categories, as of this point in time, all of our expense categories are below 100%, so we've not, right now, gone over budget any of those items. Also, if you'll take a look down in our revenues, we have been able to collect some revenues that have actually gone over what we had originally budgeted. We will have some more revenues to come in the month of July that are not reflected here, one being our Western Piedmont Council of Government allocations, which pertain to the nutrition, in-home aid, and housing and home improvement programs. And then I submitted a final 1571 in the month of May, the month of June for May services, and that is not reflected here. That actually came in as the EFT in the month of July. So if you'll take a look down at the bottom of the page, right now the balance as of the end of June, we have remaining $40,000. Again, that doesn't reflect all of our expenses or all of our revenues, but so right now we're excited that it's looking that good so far. So next month, not only will I report July monthly financials, but also the close of the fiscal year. And I'll be glad to answer any questions.
I don't have any more questions. Thank you, Sherry.
Okay, thanks.
At this time, we'll have the statistical report highlights by the supervisors.
Good afternoon. I'm Matt Reese, one of the Economic Services Supervisors. If I can draw your attention to page 1 of the statistical report, the program area Food and Nutrition, just wanted to draw your attention. In the month of June, we had total number of cases 2,778 with 6,542 participants with 128 applications and total benefits being 709,867. Just wanted to show at how in the month of June, as we close out this year, where we started out at the beginning with the total number of cases versus the total number of participants. Total number of cases is basically the total number of households. Participants would be the total number of actual individuals that are comprised in all of the cases. So the biggest shift in the number from the beginning of the year towards the end, more than likely is from a combination of us being able to combine individuals within households, because there are certain policy requirements that will allow a family to be a separate household while still being in the same home. And so there's been some changes and some shifting around, and there probably will be more as the NC Fast continues to, to kick more into high speed. But I did want to draw that attention to you. Also, as well, with the crisis intervention program, we received our first initial allocation, or our first allotment of that funding for the heating and cooling suppliers. We received approximately right around $18,000. So just wanted to draw that to your attention. It's not reflected on here, as we haven't began spending any money, or in the month of June we didn't. We did not receive it until this month of July. So, any questions?
I don't know.
And this money will be helped with some of the folks in the summertime with the hot weather and stuff.
For hot weather, that is correct. We are, the state did not change the policy hardly at all with that program from the way it was administered last year. It's requiring us to really take a look at what constitutes a crisis situation, if it truly is a heating or cooling crisis, and to attach that to it. So we're really, the public and stuff, we've had several people that have contacted our agency, and we have turned some away. Now, however, this month in July, we have approved some that maybe have, some significant health problems, or maybe have, family member, or a newborn child, or an elderly person that's in the home, that some of the temperatures that it could pose as a as a life-threatening situation to them. So
That's the most important criteria of that policy, is that it must be a life-threatening heating or cooling emergency. And so we have to be very careful. Obviously, this year, we're just this week starting to really hit those temperatures like we did last year all summer long. We do have to be careful, though, and budget wisely and use this money very wisely, in that cold weather usually will come. And it was really cold last winter, and we have to be careful in spending our money now that we'll have money to cover the winter also. So, but we certainly will do what policy allows us to.
yes, what we've been doing is it's just a couple, 3 or 4 sentences that basically summarizes the policy. What I myself last week was doing while the primary energy worker was out was reading that policy to the person that was calling and advising them, explain to me your situation, because you have to ask a lot more leading questions to really find out, are they in a crisis and a life-threatening situation or not? It's, unfortunately, the policy is not black or white, yes or no. So, but we try to we maintain consistency. That's what our drive is behind it, is to remain consistent with the decisions that we do make in regards to it. All right. Thank you.
Thank you.
Good afternoon. I'm Trina Riddle, and I supervise the Family and Children's Medicaid and Work First and Daycare. If you look on page 1 under Medicaid, I want to point out that our number of individuals receiving Medicaid from July of last year to now has not changed that much. You see each month, though, we do close to 200 applications, but a lot of those people don't return their items that we need to approve them, so we end up denying them, or they're over income and they can't meet a deductible. But I wanted to let you know that I'm sure a lot of you have heard about Affordable Care Act, and that will begin in October. We'll take applications. So we're expecting a huge influx of applications in October. A lot of those people won't be eligible for any of our services because North Carolina did not expand Medicaid. So we'll be sending them on to the marketplace, the federal marketplace, to get insurance. We also have a new position that we're hiring for, and that position will help with these applications and also help with food stamps. They'll be doing both programs. It'll be a universal worker. But we wanted to let you know about the Affordable Care Act, and you may get people asking you, we don't really know anything about it yet. Our training's in September. So all we know is that we'll evaluate them for Medicaid first and then forward them to this marketplace, but I don't know what happens once they get to the marketplace. So we just wanted to let you know about that, and that we do expect an increase of applications, along with us going into NC Fast in September also. So we have a lot of exciting stuff going on. Also, if you look on page 2 under the daycare, I wanted to let you know that Our allotment last year was $1,186,405. We spent $1,178,489. So we had a small balance of $7,916. We do not know what our new allocation is for the current year. We do know that it will be reduced again this year because they're cutting our funding. We still have 134 children on the waiting list, and we've not served any children since August of last year. So we're not putting any new children on, and we don't anticipate being able to put any on anytime soon. So I just want to let you know, be aware of that in case you get any questions about that. Do you have any questions?
I just wanted to point out, I mentioned this last month, but I wanted to mention again, because I know sometimes, and we have folks out listening to our meeting, and that when you hear that we had $7,000 left over in childcare, there are a lot of people on that waiting list that are going to hear that and say, well, why in the world didn't you call me? And I wanted to explain again to the board that if we added one child on, one child could easily use up that money and us end up having to terminate that, put them on for a few months and then have to terminate a child. So we budget that money so tight that even one more child could have caused us to go over.
Right.
And go into all county money.
And our
So-
percentage was like 99.39, so we
Right.
spent basically all of our money.
So our staff did a great job.
Right, they did an awesome job. They get it as close as they can.
And the kids, the children on this program, what's the age range for,
For Medicaid,
no, for the child care? I
for
mean,
the child care, we do through age 12.
age 12.
But right now, we're not really doing 9 to 12-year-olds. We
Doing
had to
younger
cut
children.
those out to cut down our budget.
Right.
So we're not doing any after-school care for those children right now, or any summer care for 9 to 12-year-olds. Any other questions? Thank you.
Good afternoon. I'm Lee Milstead, Child Support Supervisor. If I can have you look at page 2 at the bottom, our establishment cases and our enforcement cases are pretty much in line with what they were in July of last year. We had a few more establishment cases this year. Of course, we are still going through a transition with me being new and having turnover back there that doesn't happen very often, but we're doing real well. Also, the Medicaid cost avoidance, that's up some this month, and of course, that's the amount that Medicaid didn't have to pay out that month in claims because of private health insurance. So, and it just fluctuates from month to month. And then the paternity established and the new court orders, the paternity established are a little bit lower. We did miss one court date in June due to a judges conference, but of course, in order for us to get paternity established, we have to have a DNA test or an affidavit of parentage signed. So, okay, do you have any questions? Okay, thank you very much.
Good afternoon. I'm Holly Yongue, the Children's Services Program Manager. If I could draw your attention to page 5, where the Child Protective Services statistics are. You will see that we received 81 reports of abuse or neglect in the month of June and accepted 73 of those reports for investigation or assessment. At the end of the month, we had 100 investigations open on the last day of the month. That number is significantly higher than the month before or any of the previous months due to those 2 months of back-to-back high reporting averages. And so we would expect to see that number to go down just a little bit next month, hopefully. We had 52 in-home services cases open on the last day of the month. 56 children in foster care as of the last day of June. We currently have 13 children who have been freed are free and clear for adoption, and several of those adoptions have been filed, and we're waiting on the finalization of those adoptions. On the back of that page, on page 6, you can see that we currently have 19 licensed foster homes. I know that I've personally reviewed, we have an online system for foster home licensing once families have completed the MAP training program to become foster parents. And we're able to submit all those documents and paperwork electronically now. And so our adoptions licensing worker was out on maternity leave for a few months, but she has come back with a passion that we can barely keep up with. Has submitted probably 5 to 6 licenses to the state for families to be licensed in our county, and we're very excited about that and looking forward to having some new foster families come on board with us. And we're also about to start a pretty heavy blitz of the community to recruit foster parents within all areas of our community, hoping really to engage the faith community in that role. So I'll be glad to answer any questions that you might have.
Oh, I looked at a really pretty bulletin stuffer that she's working on today to send out to the churches.
Thank you.
Thank you, honey. If that's all of the reports, at this time, I guess it's up to the board members now to give a little bit about ourselves.
We just thought it would be a great opportunity for us. We have several new board members in the last couple of years, and we thought for our management staff and also for those listening out there that for maybe today the program would be on you to tell us a little bit about yourselves and what your interest is in being on our board.
Do I go first, or should I have
Whoever
my board
wants
members
to.
go first?
Start one in.
Okay, that's what I'm thinking. Okay, Dr. Mosley, would you go first, please?
Sure. I'm Carson Mosley, pastor of the Three Forks Baptist Church here in Alexander County. I am the proud husband of Kathy. We have 2 sons and 5 grandchildren. And I spent most of my life in the Asheville area, been down in the foothills since 2001, in Hickory for about 7 years, now here in Alexander County for 5. Academically, I have a bachelor's degree from Mars Hill College in music, Master of Divinity, and a Doctor of Ministry degree from Southeastern Baptist Theological Seminary. I have found Alexander County to be absolutely delightful. Chicken farms and cow pastures and great people. I am really blessed to serve at Three Forks Baptist Church and really enjoy that. When asked about serving on this board, my immediate reaction was no way. Don't have the time. And then I began to think about that. Jesus teaching to us about taking care of the poor and people, and say, well, Jesus said do it, so I want to do it, and to be a part of helping people. And so that's my reasoning and motivation for being here. And the process by which you get on this board has been somewhat interesting, going through the different parts of that. But I am excited about learning more about what you guys do and have been impressed already with what I've seen and heard. So I hope to make a positive contribution.
My turn. I'm Carolyn Gilreath. I have been employed as an Alexander County school teacher for 34 years, and when I retired, I came to CVCC. I've been here 5 years. I'm assistant to the director and a success coach. I got my education at Lenore College. And in my years of teaching, I taught at least one subject in grades 6 through 12. So I've had all gamuts of people to meet, their parents, and I'm now teaching children of the children, so that makes me really, really old. My husband, Jerry, is a transportation specialist for a company in Statesville. I have a son, Shannon, who's an attorney. He teaches law at Wake Forest University and writes textbooks. I have a daughter, Holly, who has a master's in healthcare administration, and she works as a clinical liaison for a hospital in Greensboro. And I can't get either one of them to get married, so I don't know if I'm going to have any grandchildren before I'm too feeble to hold them, but I'd like to. So I guess that's it. Oh, as far as being on the board, when I taught, I saw all kinds of children in lots of different situations and listened to some of the family problems that they were having. And the elderly and the children are the people that I think need the most help, and they're the ones that I care most about. So that was one of my motivations for getting on the board, to see what DSS was doing for our families.
We're done. I was fortunate enough to grow up in this county. My mother was an elder who was actually the sister to Shelley's father-in-law, and she married a guy from Bethlehem, and they raised me in Bethlehem community, and I went to school at Bethlehem Elementary School, and I was the last graduating class from the Taylorsville High School from 1970, so I was proud of that. And then I went on for my real education at the University of North Carolina at Chapel Hill, and in 1972, after my second year in college, I came home and was looking for a summer job, and I met a very wonderful person by the name of Roe Campbell. He found my drugstore in 1918. He taught me about the love of caring for the people of Alexander County, and he truly cared for the people of this county. He was the gentleman who, in the World War II, if a family member died, he'd get the telegram at the drugstore and he'd go out to the family. He'd close the drugstore and go out to their homes and express to them his sorrow and take the telegram and tell them about their family dying. And then I was mentored by his son, Roe Campbell Jr. and Louis Ferguson, both have deceased now. In 1975, I finished college and came back here and started a family. Married to Vicki Eichert. She's a retired school secretary, and we have 2 children. I have a son, Phil. He has a master's and a PhD from University of North Carolina, Chapel Hill. He is a child psychologist, and he's truly a Dr. Phil. The only difference between him and the one on TV is about $38 million a year. And then my daughter is Felicia, and she is a pediatric oncology nurse at Charlotte. She recently got married, and she brought shame upon our family. She married a Duke fan, so we were trying to live with that. And she blessed us with a grandson. He's 8 years old, and we're trying to raise him right. I sing "Jesus loves me" and the Tar Heel Fight song to him all the time to get him acclimated to the right things in life. And we're enjoying that part of our life very much. My goal in life right now is to make it to 2018, which is another 5 years. And the business that I own will be 100 years old, which I think is I think it's just great to have a small business that lasts that long in a small county, and I'm real excited about that. I attend East Taylorsville Baptist Church, and at one time in my life, I was honored to spend 8 years as a county commissioner, and my comment about that is that the Lord's forgiven me. I just wish the people would. I enjoy that experience and my interest in being on the board. I never got to serve on the Social Service Board when I was a county commissioner. And I see your recipients and the folks you take care of every day at my job, and I just wanted to learn a little bit more about it and, maybe learn some things I can help guide them to find some things to help them in their lives. And this has been a blessing to be on this board, and I truly appreciate it. Thank you very much.
Okay, I am Barbara Mays. When I came onto the board, I was scared to death. Look where I am now. Chairperson, but I was scared to death. Gladys Hill was the one that asked me to do this. I knew nothing whatsoever about DSS. So I thought, well, I'll try it. And I've grown to love you all, the DSS board. I just couldn't believe the things that you do. And I'm so proud to be part of this board because it is a learning situation. And I have had chances to help people in the community by sending them to you for help. I attended CVCC, and I had business classes, and I have my certificate in medical terminology. I am employed by the Alexander County Library. I'm married to Willis Mays Sr., and this is my second marriage in here, so we have children. We have children. So, and I have a granddaughter that is in Afghanistan that I am so proud of. So you all remember her in your prayers. She should be home by October if everything goes well. And I'm a member of Macedonia Baptist Church on Highway 90. And that's my story. So, and like I said, I have truly enjoyed it. And as far, I would love to stay on the board, you know, as long as can, but I would love for somebody else to chair after this year. I think again, I'm letting them see that it's okay, you know. It just motions and things, but I have certainly enjoyed it. So at this time now, we will have our items from the directors, Cindy Holman.
Well, thank you, and I just want to say, let's give them a hand. We really appreciate our board, and we are very blessed in the, we have a lot of differences and different types of employment and background, and that certainly serves us well in the work that we do, because we do serve a diverse population. So thank you so much to all of you. I wanted to just review, I'm almost afraid to say it out loud, I'll knock on wood. We don't have any vacancies prior to our new positions that were approved in the budget this year. We do have those positions, 2 social work positions, 1 income maintenance position, and then 3 part-time positions that we have one position posted right now. But we are doing some, we're looking internally at what we need for those positions, and as we're considering our needs for NC Fast, we're having to rewrite job descriptions. We're having to adjust to words like universal worker, and I think child welfare is going to be looking at, our goal for July was to rewrite all of our job descriptions for the agency, and everybody's been really, the management team has been really busy with that. We wanted everything to be up to date and reflect up to the minute information, and we have some multidisciplinary social work positions, and so we're working real hard on all of that, but we do not have any past vacancies, only our new positions, so we are very fortunate and very thrilled to be able to say that right now with everything that we have going on. I did want to give you a little update as to our NC Fast North Carolina families accessing services through technology. Matthew, I know, is so proud of me for being able to remember. You've heard us talk a lot about this in the past year. We are in full rollout. We're in the FNS program, in Medicaid. We'll roll out, I think, our soft launches in September, early September. We'll begin training in the month of August. We have been preparing ourselves, and you've heard us say this, acronym, NC Fast, over and over again. But it is an all-consuming thing for our economic services programs. We are looking at the way we do business, and there are a couple of terms that are floating around in the Directors Association right now. One is work support strategies, and that term is more as to the agency overall and how we conduct our business and how can we do things more efficiently, more effectively. And next month, as you see down here, number 4, I'm going to jump to that. Erin Hinderlight, who is going to be a state representative, is going to come in and do a program for us on work support strategies. That'll be next month at the board meeting. So I know you'll be real interested in that. But back to NC Fast. We have tried some things. We've tried some things that have gone really well and some things that didn't go so well. We are trying to figure out how to handle workflow and volume, and the system itself has had a number of problems, but no more than you would expect to roll out a system this big in North Carolina. It's the best opportunity we've ever had to go into automation. So we have, in the last couple of days, this week has been really frustrating. Our staff are real frustrated today. The system's been down more than it's been up, and we've had a really hard time. And we're trying to keep benefits to our clients who need them. So we're trying to learn a new system, trying to man a system that's not working at top-notch capacity, and also make sure we take care of our clients. So it's a tough time. In preparation for all of this, there is, you've heard us say the word, another acronym, EPASS, which is a system through which clients in our community can apply for benefits online. And once they make that application, it comes into what they're calling a queue at our office. And right now, Matthew Reese, our F&S supervisor, pulls those applications out of the queue, and then we work up those applications. We still have to have a telephone call, interview, or bring that person into the office, depending on what kinds of verifications and information that they need to give us. But we are, going through that process right now. We tried some steps to keep some of the traffic, the phone calls, and the constant people coming in at the front desk from keeping our staff constantly busy with someone in front of them and not able to process within the system. And we tried some things that didn't work out so great, and our staff, said, okay, you really need to think about this or that. And it is with anything that you try, your people who actually do the job are the people that have the most information. So we regrouped, and we've tried to really engage our line staff in all decision making from here forward. We are bringing them together once a week right now. They have helped us to appoint a representative from the different programs, and I'm calling it the NCFAS delegation team. But that team has gone out. We went to Catawba County and also to McDowell County. Was that just yesterday? Today's been a long day. And looked at what they are doing. Catawba is a pilot, or was a pilot county for FNS. McDowell County is just a really progressive little county that has a lot of technology going and a lot of real interest in being persistently aggressive towards automation. And so we looked at their processes. We're not trying to mimic their way. We're trying to find Alexander's way. And we went and looked, and we took our line staff with us and our supervisors with us, and we've not had an opportunity to get back together and talk about everything that we saw, but we do have a meeting coming up later this week where we'll share some of that with our staff. But we wanted you to know that we are very intentionally planning for NCFAS as it comes at us in our different programs. And Medicaid will be next. And Trina and Matthew both have some Medicaid folks on their teams. Trina has the Family and Children's Medicaid, which is where most of the new folks will be involved with NCFAS. But is there anything else y'all would like to say about, is that a kind of a summary of where we are? So we like to keep you abreast of that. I did want to mention that I would like for us to consider, and I would like to put it before you to consider and see what your thoughts are about possibly planning a board retreat, just on a day sometime in September. I wondered if you might be able to come up with a day that you would be able to, we've not asked you to do this in the past, but I think it's real important with so many changes in our work going on that any of you who could come, if we picked a date, and I was wondering if the day of our board meeting might be a good day for us to have that. We perhaps could start with a late morning, maybe an 11 o'clock start, and have lunch together and go through, and then have our board meeting that afternoon. I didn't know if that might be something that you could be able to do, or, and I won't make you answer in here today. I know some of you have.
No, I have, in addition to that, I've always thought we should have a walk through the social service building, because I feel like sometimes you talk about space, and we hear you say it, but we can't see it visually. And if I could incorporate that as part of the retreat, as just a tour of the building and the office
Sure.
space.
That's a great idea.
That way we can visually see what's going on there.
We'll plan to do that, and you can individually let me know if that September 17th date would work for you. And we'll certainly, plan to provide some lunch and really kind of do a little dog and pony show, just so that you can have some idea of each one of the programs. We'll try to bring our staff in and introduce them to you, and let you have a little flavor. We'll take you through, give you the tour, let you see what it's like to come in the front door, and maybe to apply for services, who you talk to, and those kinds of things. I think that's a great idea, Phil. I appreciate it. The note about here it is. We do need to, if possible, change the August meeting from, it normally would be on August the 20th. We need to change it to August the 27th to accommodate that state person who would be visiting with us to provide our program. Is there anyone that would be a problem for, to switch the board meeting to the 27th? And you might need to, I'm not sure if you'll need to vote to change that. I'm sure you probably do, since our agenda, if you don't mind, Barbara.
You want me to vote now?
You can, if you'd like
Okay.
to.
All those in favor of changing our August date to August the 27th, could I get a motion on that to accept that?
I make a motion.
Did I get a second?
I'll second it.
Okay, it's been moved and second that we switch our August meeting from the 20th to the 27th, if I have that correct. To the 27th.
Correct.
All in favor, say aye.
Aye.
Is there any opposers to that day? Okay.
Thank
Okay,
you.
then.
And the last thing I just did want to mention is that I spoke with our school superintendent just this morning. We are looking at, I know that I had mentioned to you before, our Golden Leaf proposal that we put forward that unfortunately did not get funded, but we're very proud of the Golden Leaf funds that are going to come into the community for education, but we did put forward a request for 2 workers in our child welfare area this year, and that was funded by the commissioners, and we are going to follow through with that collaboration with the school system, and we'll be placing those workers, one that will rotate between the middle schools and one that will be at the high school. And I think I've probably mentioned that to you a couple of times, but I wanted you to know that that collaboration is ongoing, and we are going to be meeting and talking about how we'll handle that. Those will be multidisciplinary workers that will carry a caseload of a variety of different responsibilities within child welfare. So we're very excited about that. I think it's a real good opportunity for us to have improve on the already good working relationship we have with the school system. So we're excited about that. And we might put that forward for a best practice award maybe next year, when the time comes around for the Social Services Institute, which I did not put that on here, but I did want to remind you today that the Social Services Institute this year is scheduled for the 23rd, 24th, and 25th of October. It will be in Hickory, I believe at the Metro Center. That's where it has been before when it's been in Catawba County. But that's driving distance. I imagine a number of our staff will participate. There will be a social services, a board meeting of the Board of Social Services, the larger board. And you will be able to participate that, and all of you who are interested, will send you more information when the registration materials coming in.
Okay.
And I believe that's all that I have.
Okay, at this time, is there any items from the board to be discussed today? Anything? If not, then the next meeting of the DSS will be August the 27th at 4 o'clock at CVCC. And do I get a motion at this time to adjourn?
I make a motion to adjourn.
Do I get a second?
Second.
It's been moved and second that we adjourn until August the 27th. Thank you very much.